Well, ladies and gentlemen, good afternoon. My name is John Allen. I'm the president of the Brookings Institution. It's a great pleasure to welcome you today to this public event. It's a very sobering event. It's entitled The Opioid Crisis in America: Prevention, Treatment, and Regulation. Now, while the United States reels from the COVID-19 pandemic, the epidemic of opioid use disorder, or OUD, continues to ravage our country, costing a staggering loss of American lives of nearly 400,000 precious Americans. They've expired, they have died of OUD since 2000. The effects of OUD have devastated communities and cities across the country. In 2018, an estimated 2,350,000 Americans were found to suffer from OUD. Those without treatment, or sometimes even with treatment, often were unable to maintain employment or continue relations with family and friends. And sometimes the substance dependence was so great that they were even subject to criminal prosecution, leading to imprisonment. In turn, the US economy has taken a blow due to the opioid crisis. The US Council of Economic Advisors estimates that the effects of OUD cost the US economy nearly $700 billion in 2018. Further, the opioid epidemic has exposed critical weaknesses in current US drug policy, as well as in existing health and welfare systems available to our lower income population. Recognizing the urgency of this crisis, Brookings has undertaken a multidisciplinary approach. Drawing from experts from programs across the institution, it is with great pride that we launch our newest series, The Opioid Crisis in America: Domestic and International Dimensions. Under the leadership of our senior fellows, Vonda Felbab-Brown and Carol Graham, this series will convene policy and stakeholders at the local, state, and federal levels, as well as members of the public who are on the front lines of the opioid crisis. Today, they, alongside a panel of experts moderated by NPR journalist Brian Mann, will be sharing their latest findings on prevention, treatment, and regulation. And to kick off this inaugural event, we are honored to welcome Congressman David Trone as today's keynote speaker. Elected in 2018, Congressman Trone serves as the representative of Maryland's 6th Congressional District, and is a member of the Education and Labor, Foreign Affairs, and Joint Economic Committees, and has been a tireless leader on the opioid crisis. He currently chairs the bipartisan House Freshman Working Group on Addiction, and last month he was appointed by Speaker Pelosi to serve on the Commission on Combating Synthetic Opioid Crisis Trafficking. Welcome, Congressman. It's a great pleasure and an honor to have you with us today for this crucial conversation. But before I turn the floor over to Congressman Trone, a brief reminder that we are on the record today and we're streaming live. So please feel free to submit your questions to us via email at events@brookings.edu. That's events@brookings.edu, or to use the Twitter hashtag at #opioid crisis. That's #opioid crisis. Congressman Trone, sir, the floor is yours.
Fantastic. Thank you so much for inviting me here to speak today. The Brookings Institute is a wonderful resource for having a really substantive conversation today about how we can work together to fight the opioid crisis in America. Some of you, may be aware that I came here through a personal journey, and that connection was through my nephew. My nephew's name was Ian Trone, and he died of a fentanyl overdose on New Year's Eve in 2016, alone in a hotel room. He had been sober and clean for 13 of the last 16 months of his life. Ian suffered from addiction, and I, along with my wife, we worked for over 5 years to try and get him and help him stay sober and clean. I helped him navigate on a weekly basis, sometimes on a daily basis, a confusing system so we can access treatment and recovery services. I witnessed firsthand how we're failing those most in need. So I came to Congress, I left the business world, and the opioid crisis is clearly the #1 crisis in America. And COVID is incredibly horrific, but at the same time, we can't let it overshadow what, as you just was said, was 400,000 lives, that we've lost, almost 70,000 a year recently. In order to tackle these problems, we have to look at a combination of 3 pillars: mental health, addiction, and incarceration. I saw personally how these pillars interact within, and we clearly need to do better. Right after I was sworn into Congress, one of my first actions was to form the Freshman Working Group on Addiction. It's a bipartisan group, 65 members, 35 states. We've come together to lend fresh eyes, together as a team, to fight the addiction crisis in this country. We're committed to addressing this crisis through prevention, treatment, and recovery, and ensuring that community-based care and families are included as part of it. In total, our group has sponsored over 35 bills now to address the challenges related to addiction and mental health. And we're working hard to push these through committee and get them voted on. This is a large number of bills, but we know, as you do, there's no silver bullet to ending this epidemic. And we need to approach the problem from many, many different angles. One big win we've had so far is a bill I introduced, secured $7.5 billion in funding for SOR, state opioid response grants, going out 5 years. So we have consistency of funding. Unfortunately, the bill is stalled in the Senate. I'm working now with Senate Republicans, and I believe we're making some progress, and I'm very hopeful. Another bill I introduced, and I'm particularly excited about, is the Family Support Services for Addiction Act. Legislation establishes a grant program for nonprofit family, communities, and organizations that provide support for families of individuals, because it's not just the person struggling, but it's really impossibly challenging for those of us that are trying to make sense of this disease and lend help when we're so emotionally affected. So often these families get left behind, and I saw that in my own personal experience, so we can help them navigate the path to recovery. I'm also an original sponsor on an important bill with Congresswoman Lori Trahan, the Medication Access and Training Expansion Act. This bill would standardize disorder training to ensure that all prescribers of controlled substances like opioids have baseline knowledge of evidence-based and addiction prevention and treatment. Our Freshman Working Group on Addiction has made progress in bringing attention to this important issue, which is why I was honored, as was mentioned before, to be appointed by Speaker Pelosi to serve on the Commission on Combating Synthetic Opioid Trafficking. I'm looking forward to using that opportunity to explore synthetic opioid production, supply chains, China, Mexico, India, and halting the number of opioids that enter our country. I'm also introducing a bill very shortly that will encourage the State Department to do more to combat synthetic opioids and other drugs coming into this country. In the area of mental health, it's so directly tied to addiction, so connected. We can't tackle them separately. One of my most the most vital providers of mental health and addiction treatment are the certified community behavioral health centers, clinics. Representative Matsui and Senator Stabenow have done phenomenal work. Their bill, the Excellence in Mental Health and Addiction Treatment Act, would provide states that currently participating in certified community behavioral health clinics, a Medicaid demonstration project with 2 additional years of funding and expand it to 11 additional states. The early data coming back on this is excellent. It's also critical that we ensure mental health care for justice-involved individuals. According to the Bureau of Statistics, 1 in 7 individuals incarcerated in state and local prisons is affected by mental health, and 1 in 4 are self-reporting serious psychological distress in the past 30 days. My Crisis and Stabilization Community Reentry Act would allow law enforcement to partner with mental health providers and provide mental health treatment and crisis stabilization for incarcerated individuals and promote a warm handoff. That's the key. When they leave, we need a warm handoff to community-based centers upon reentry. The bill also seeks to fill an urgent need for justice-impacted individuals in those communities they reenter. COVID-19. While the opioid crisis and mental health are huge problems before COVID, this pandemic has only intensified those issues. It's critical. In our response to this pandemic, we focus on those needs with substance use disorder and the mental health providers who support them. One of the ways we can do this is the funding in the COVID relief package passed by Congress. The 4 laws that have passed by Congress so far have provided billions of funding to hospitals and healthcare providers for PPE, medical supplies, critical research. But in addition, we have to get adequate funding for mental health, behavioral health services. The CARES Act has $425 million for SAMHSA, including $250 million for the certified community behavioral health clinics and $50 million for suicide prevention programs. We lost 47,000 people last year to suicide. This is a good start, but it's nowhere near enough funding to meet the increased needs caused by the pandemic. I was happy to get the HEROES Act passed by the House in May. It contained many of the priorities that I spoke with Speaker Pelosi about, including $1 billion for community mental health services block grants, $1.5 billion for substance abuse prevention treatment block grants, and $10 million for a national child traumatic stress network. We also put in a new 988 National Suicide Prevention Hotline. Fortunately, doesn't appear the Senate is moving soon. But that's exactly why we need advocates like you to put pressure on the Senate and push for the HEROES Act to move through. But our ends don't end there. In these packages, I've been pressing leadership to provide supplemental funding for mental health and addiction services programs. We need $38.5 billion for these behavioral health centers. Healthcare providers and organizations that offer behavioral health need more support because of the lost revenue and the increased costs. We're going to continue fighting for this. Thank you for inviting us to speak today and for having this important conversation. It's really critical that you the experts, work with us on the Hill. We really need your assistance. We need your expertise. In business, I learned early on, the best ideas come from the folks in the field. that are dealing day after day after day with the problem. They see the processes that don't work. They feel the urgency. And we really need your help. And I encourage everybody to feel free and plead you to reach out to our office, offer us help, and offer us help with the commission as we get our commission up and running. And we'll have with us on the commission all the top executive members of the administration and eventually a future administration. So we need to keep our eye on the prize, end addiction, and the mental health crisis in America. But thank you. Thank you all very, very much. Thank you very much for your work. I look forward to answering some questions.
Congressman Trone, thank you so much for the excellent opening remarks, their comprehensiveness and forthrightness. And thank you, Congressman, for your extraordinary dedication to this absolutely fundamental issue in the United States. And frankly, increasingly around the world as well. We are thrilled to be able to continue cooperating with your office and the commissions and work in the Congress that you lead. I was very impressed by the range of issues that you touched on in your opening remarks. And I am thrilled to hear their comprehensiveness and also that they resonate with the papers that we are launching today as part of the series. The papers touch on everything from prevention, treatment, regulatory design, state responses, issues such as block grants to states that you spoke about, domestic law enforcement and external law enforcement. And they also focus and highlight particularly vulnerable groups, such as women and children, veterans, or US communities that have been subject to declining income, manufacturing, and now also COVID. So I look very much forward to continuing exchange. General Allen was very gracious to mention Carol Graham's and my work and leadership on this, but I also want to highlight all the authors that we brought from other prestigious institutions who are really some of the US top experts. And so it's been extraordinarily gratifying collaborating with them. And I look forward to more sustained engagement with you. If you would please allow me to now probe some of the issues that you raised. And perhaps start with the issue that you highlighted, namely supply of fentanyl from abroad. It's the work of the commission that you that is just being created that you will be heading. China has been the principal source of fentanyl for the United States, and both the Obama and Trump administration worked for many years with China to get China to schedule to ban the sales and exports of fentanyl class drugs unless special permissions are issued. That legislation came into effect in China last year. The issue now is how China will effectively enforce this new legislation or not. And of course, this is taking place in the context of perhaps the lowest point in US-China relations in decades. Some people speak about the US and China being on the verge of a new Cold War. What, in your view, as you are starting to formulate the commission, is a fruitful way to engage with China now to motivate China to diligently enforce the new regulations?
I think you hit the nail on the head. The key is enforcement. We worked with Senator Alexander, who a year ago went over to China, and that's what enabled and put the pressure on China, where they actually went out and called out fentanyl as a scheduled drug. But since then, just what you said, nothing has happened to speak of other than one particular incident. So we need to convince China that it's in their best interest to not be a rogue nation, a Colombia of Asia, supplying drugs and killing 70,000 plus Americans every year. So we work with Senator Alexandra. We're also working with the U.S. Ambassador Terry Branstad to China, who's been really great on this issue and a pleasure to work with. Assistant Secretary of State, Brigadier General Stilwell, who's very focused on this. And of course, Jim Carroll, President Trump's drug czar. So I've been working with all three of them to put together a CODEL, a bipartisan CODEL with the executive branch to China, which was to go in May. So we were going to be there, meet with all the officials. We had it rolling. We were also going to Mexico too, of course, because that's key, as you mentioned. But in China, they've got to want to do it. And otherwise, we have no chance. And obviously our relations, as you said, are at an all-time nadir. So we've got to figure out how to convince them that there's positive publicity, there's no negativity about doing the right thing. But we need to get over there and spend time with them. And we need to figure out how to get over to Mexico, because roughly 50% now of the drug is coming in through precursor chemicals into Mexico, the two Western ports. So we're working with the Mexican government is the plan in those ports to figure out where we can cut off the drugs that comes in. But it's the problem, of course, is fentanyl is used legally and illegally. So we've got to figure out ways to separate that and have a trail the whole way from manufacturing in China to here. But without their cooperation, I'm afraid we're going to have a tough time. But this is going to be the key for the commission, the international peace, China, and potentially down the road, India, because they're such a huge, petrochemical country. And we're concerned that once things get enforced in one location, it'll bounce somewhere else. So I want to try and get out ahead of the game.
Sorry, go ahead.
Yep, that's it. I'm good.
Well, that's indeed very prescient, because the experience of global narcotics or counter-narcotics policy is, of course, the so-called spillover effects, with success in suppression in one location, pushing it elsewhere. And we are already today seeing the establishment of connections between large Mexican drug trafficking organization and India as a source of fentanyl precursors and, in fact, synthetic drugs overall. Let me stay a little bit with enforcement and perhaps focus on the domestic side of enforcement, which has been often a difficult dimension, often a troubled dimension of US drug policy. And certainly we are today in a situation where many people who are incarcerated continue to suffer from opioid use disorder, or for that matter, other substance disorder, but they often cannot access treatment. What is your thinking or the work of the committees that you have been engaged with on the idea of lifting constraints of Medicare to cover drug addiction treatment while people are incarcerated?
Well, we certainly know that prisons are some of the biggest providers of substance use disorder out there, and the treatment just not happening. So Medicaid is a key in expanding that treatment. So we need to absolutely move forward there. And Amy Custer has the bill, on this area, and we're supporting that bill as a co-sponsor. But what's happening in prisons is a failure of not only opioids, but also mental health. They're all tied together. I have 7 prisons in my district. So I visited with all of the prisons, meet with the wardens, the inmates, the unions, the guards, everybody, trying to understand what's going on. And just for example, the area of, MAT. I mean, we absolutely have got to have MAT in the prisons. We largely do not. And the mental health piece, as I recently had a prison had 1,300 inmates, 1 mental health counselor. It's crazy. But we have to take the money in prisons and pay it forward. We're spending $80 billion a year in prisons, and we're getting the 75% recidivism rate 5 years later. So it's just a revolving door. And the way to stop that door and literally save billions of dollars is to put it forward into education and to opioid substance use disorder treatment, mental health treatment, and put all that on the front end. We've also been meeting with the head of the Bureau of Prisons on the federal side. And that's something that we're going to continue to meet. And we've been talking to the potential Biden administration about all of these subjects already, so we can help get on the ground floor on forming a real consensus to move forward on substance use, mental health, a real second chance act that makes meaningful reform in our prison system. We made a step 2 years ago, but it was a small step. There's just so much more to do there. I've been working with the American Civil Liberties Union on criminal justice reform for over a decade. And it's just such a crucial area that people that don't have a voice are just being totally left behind. Why does our country have 25% of the world's prisoners? And we're 4.3% of the world's population. It's an embarrassment. And of course, what's happening now across America is certainly part and parcel of this whole situation. And addiction has to be the disease. It's certainly not a reason to incarcerate somebody. That's just dead wrong.
Thank you, sir, for saying those words. I am absolutely thrilled to hear them. And I believe that all of the authors and great colleagues on the project would heartily endorse that, the view that we need to treat substance use disorder, addiction, as an illness and not reason to incarcerate people. And certainly COVID only drives home further the need to very significantly reduce prison populations, incarcerated people in the United States, to reserve incarceration for other types of crimes. And the whole issue of changing the view of substance use disorder toward illness also then raises a whole set of questions, such as medication-assisted treatment that you mentioned, MAT, for some of our viewers who might perhaps not know the term. One of the issues that has been effective in other parts of the world is supervised injection sites. That still remains a controversial issue in the United States. The Department of Justice has been trying to block the capacity of local communities to experiment with supervised injection sites. What is your view on that issue?
Full speed ahead. If we don't try and be innovative, if we don't welcome change, if we don't embrace change and embrace some failure, because we're going to have some failure, but we've got to get out there, we're going to do things. And these injection sites in Europe and Canada have proven very, very incredibly effective. And we'd be fools not to explore this. Harm reduction is the overall key. And that's what these injection sites do. It's crucial that we get Narcan with everyone. Also, I know my staff, we trained on Narcan, and one of our staff members actually had the opportunity to save a life when someone had overdosed, but they had gone through the training, they carried the Narcan. And all these families that are living with folks that have addiction, they've got to have Narcan in their house. I mean, this is an unbelievable drug. And, we've got to embrace that. And of course, MAT is crucial, but injection sites, safe injection sites, is an idea that has come a long time ago, and America needs to get with the program.
Well, Congressman Trone, thank you again so much for your remarks and, more importantly, for your dedication to the issue. For those of us who have worked on drug policy for many years, too many decades, I should say, it is enormously rewarding to see that reform ideas are being embraced by our representatives, and your leadership in this domain has really been inspiring, as well as enormously gratifying. So thank you so much, sir, and I look very much forward to continue feeding information from the work that we have been doing at Brookings, that we will continue to be doing with Brookings as part of this project with the Brookings team and our stellar external authors and engaging with you and representatives of both Congress as well as the executive, state levels and local levels in delivering that information.
Fantastic. Thank you for the time, and thank you for all the hard work. I mean, we've all got to pull together as a country. I mean, it's 400,000 folks, and that's affected tens of millions of people. You know, we've got to get our hands around this. We've shown we can pull together as a country on COVID. Well, we ought to be able to pull together as a country on substance use disorder in the same way, the same intensity, and we can really make a difference. So thank you, thank the General, and thank Brookings. Have a great day.
Thanks for watching. Be sure to like and subscribe for more videos from Brookings.